Hi guys, this is Cristian from ArtSmiles. How are you? So I'd like to present this case that I've done a couple of weeks ago. This is a full mouth rehabilitation. This is a very, very nice patient that we had here. It was a pleasure to treat this guy. This case, initially, in my view, it's an orthodontic case. This patient, actually, he tried to do ortho twice with a clinic here on the Gold Coast, but he had some problems with compliance of using the Invisalign. So he came to me asking for a solution using a full mouth rehabilitation. As you can see here, one big issue that we have here is the deep bite. So the bite was so deep that was really, really difficult to rehabilitate, and he went to a few other clinicians, and nobody would like to do a rehabilitation for him. So I took the case and we started. Here you can see how we do rehabilitations. So we start with the planning. The planning is essential, okay? In this initial step, or when we do the planning, I take scans of the patient. I discuss the problems that we could have, the risks of the treatment, and I take many photos, and we discuss what possible outcomes that we're gonna have. So once I have all this information, I send all this material to the lab, and the lab, the dental lab, they produce a digital Mocap. This is the first view of the what's going to be the treatment. So at least this helps me a lot how to predict problems, how to address issues, and how to make the smile beautiful. And it's a very good communication tool with the patient as well. Okay, so once we have the digital Mocap, the patient gives thumbs up, everything is good, we can book the appointment. So I book an appointment to do the preparations. In this case, I booked with this patient one full day, and I prepared the upper and lower jaw. So this is his mouth when we did the temporization. This is the temporary veneers. In this case, we worked with Emax veneers, upper and bottom, in all teeth. And this, after doing this day of the preparation, we wait. I send all this information to the lab, and they produce the veneers, the crowns, whatever we want to do, and then I book another day for the cementation. So this is the overview of most of my rehabilitations. I do it this way. When it's super complex, the case, sometimes I like to do the Mocap in the chair if the lab has some difficulties to understand how to do the case. So I do in chair the initial Mocap, and then after that the lab produces the digital Mocap. So here you can see the difference at the beginning of the case, the initial step when we started, and this second part here is the digital Mocap. So you can see the difference. You see here, I provided the lab already a new vertical dimension for this case, and you can see that the teeth are not biting because I predict how much it would be good for the patient to speak and to smile. And I created this new space, and the lab worked the new smile considering the space that I reserved for the rehabilitation. Here is the same. As you can see, the lateral photo, you can see the difference. One interesting thing, you see that the angulation of the central incisors, they were much more angulated like this. And what I requested the lab to do was to make it a bit more flat. This patient is class 2. Class 2 means that the upper jaw is too forward compared to the lower. And that's why, in his case, to compensate, his teeth migrated back. If I put the correct angulation for the upper, I would go this way, but then the teeth would be too far from each other. So the lab produced a more straight tooth in the upper, and a little bit more forward the lower one. So that's the solution that we found for this case. As this patient didn't want, he wanted a quick result. We didn't plan any implant for this case because he was happy to do a bridge. So, and that's what we've done in this area here. We created just a bridge in this area between premolar and molar. So this is the initial result. This is a temporary material. After doing doing the preparations, remember that I said that the patient came here. It was a full day just for the patient, and in the morning I prepared all the upper. In the afternoon I prepared the lower, and I scanned everything. I sent to the lab, and this is the initial the temporary teeth. At least it's a very good. It gives us a very good idea about the positioning of the teeth, any problems that we could have, you know. And I take these photos and send to the lab with the scanning, so we can. The lab has a very good idea what's going to be the outcome. The patient was really happy with this outcome already. This temporary, and then we just asked the lab to do the treatment. So this is the final result. In the second appointment, when the patient returns to fit the crowns and the veneers, I reserved, I think was between 5 hours to do everything, to cement upper and lower jaw. And the color here is a bleach color, it's a BL3, but it's not Hollywood smile. I don't like working with this super bright. I think it's fake. Sorry, it's just my opinion. I like to produce natural looking and white smiles, but nothing that looks fake. But in the end, it's the patient's opinion, and I think we achieved a very good result in this case. Yeah, and here you can see before and after how we did this case. From the beginning until the end of this treatment, I believe we took around a month, I think, a month, maybe 40 days. And we did 4 appointments, 1 appointment for planning, 1 appointment for preparation, another appointment for cementation of the veneers, and 1 last appointment to fit the splint. I always like to use a mouth guard to protect the veneers from grinding, and this patient now is using a splint as well. So if this is something that you want to do, this is at least you have an idea how I work. And for me, it's a pleasure if you want to come and come for a consultation, and we can discuss your case. Thank you very much.